So we're going to go ahead and kind of start here. My name is Ashley Ragsdale. I'm the Executive Director of the Healing Words Foundation and Prairie Doc Programming. Thanks to all for joining us here today through Zoom. We are excited to be able to provide some more health education in regards to Medicare. We know that it is a complicated process getting signed up, and we are happy to have two representatives of the SHIINE program here. I'm going to let them introduce themselves, and then we're going to start here with our program. Waylon, you want to start?
Hey, good morning, everyone. I appreciate everybody coming in and inviting me and Terry to talk today. I am the director of the SHIINE program out of Pierre, and I manage the program for all 66 counties and oversee 9 Medicare educators, to include Terry, who's one of our lead educators out of Sioux Falls, and manage a volunteer program right now of about 77 active volunteers that are currently working during open enrollment. So I appreciate you coming in, and if there's any questions specific about the program itself, I'll speak on that a little bit towards the end of the day, and we'll make sure you have contact information for me and the program managers as well.
Terry, you want to tell us a little bit about yourself? Oop, Terry, we're having some trouble hearing you.
Is that better?
Yep.
Okay. Still some echo there, but this is my 4th year as a Medicare educator, and doing my 4th open enrollment, which is where we see a lot of people. Seen about 150 people already in this month and a half. So we answer a lot of questions and help them find the best Part D plan. So. Are we ready to go on from here?
I think we're ready. I'm going to pull up the presentation and share our screen here. And we're going to move to our presentation here today. So I will let you guys take over.
Okay, as this says, new to Medicare, and we'll look at parts A and B, C, and D. What I want you to see is the SHIINE logo, and SHIINE stands for Senior Health Information and Insurance Education. And that is the name we chose for our SHIP and SMP for the state of South Dakota. So the SHIP is actually State Health Insurance Assistance Program, and its goal was to help people navigate Medicare. Our sister program, Senior Medicare Patrol, is help for preventing Medicare fraud and abuse. Next slide. So today we want to do an overview of Medicare, when and how to enroll, and the resources that are available. Next. Who will benefit from this presentation? Individuals who are approaching age 65. We really appreciate it when those who are 64 start looking at Medicare and trying to figure it out for themselves. Those who are currently working and considering retiring, and that can be after age 65. And those receiving Social Security disability benefit. Next. Medicare can be confusing, said about everybody. And so the people who actually start looking for the answers to that confusing question are the ones that find them. So, and that is our purpose, is to help people find those answers. So next slide, please. So the confusion for Medicare comes around this question right here. Am I going to take option 1 or option 2? Option 1 is called original Medicare. That's when you have Part A and Part B. And then Medicare only covers 80% of the cost. So you need a supplement that we call a Medigap that picks up the other 20%. Then it wraps around and picks up the copays and all the deductibles except one. And then we also have to have a Part D drug plan to cover prescription drugs. Option 2, also called Part C, is called the Medicare Advantage Plan. And it takes all the 4 parts of original Medicare and puts them into one insurance policy. And that policy is where you get all the extra benefits like vision, dental, and hearing. So in both of these, you have to have been enrolled in both A and B and continue in both A and B. Next. Who is eligible? It's health insurance for people who are 65 and older, even though the retirement age continues to rise. Medicare is at 65. So it's under 65 with certain disabilities at any age with end-stage renal disease. Others who may qualify are those lawfully permanent residents who are at least 65 or older and have lived in the U.S. for 5 continuous years. That does not qualify them for free Part A, but they are eligible to receive it. Next. So the 2 basic parts are Part A and B. Medicare A covers inpatient hospital care, and the skilled nursing and home health care are a result of having been in the hospital. You can also receive later on hospice care as needed. But Part A deals with the hospital coverage. Next. So inpatient care in a hospital, it's your semi-private room, meals, general nursing, and other hospital services and supplies. The inpatient skilled nursing care comes only after a 3-day inpatient hospital stay, and it's for the purposes of rehab. Next. So you can also get home health care services for your rehab purposes, and again, like hospice care. Next. Costs associated with Part A. It is premium free for people who have earned 40 work quarters. And that is why in order to enroll in Medicare, you have to go to Social Security because they have your work, what you've worked. So, and you see the inpatient hospital care, there is a $1,600 deductible. per benefit period. If you have the supplemental, that will pick up the Part A deductible. Next. So one of the questions you have to ask if you're looking at needing rehab is, am I an inpatient or am I on observational status? If you're on observational status, it doesn't qualify you for rehab in a nursing home. So you need to know the difference between how you have been admitted. If you have come in through the emergency room, you may be on observation. So how do I find out? You don't ask the doctor or the nurse. You need to talk to the social worker. She is the one that knows all about this. Next. Medicare Part B covers all the rest of your medical. Covers all your physician services, in and outpatient. Covers many preventive health benefits, including your annual wellness exam and all the things that really come out of that wellness exam. It covers vaccines, all of the current ones, including shingles. It says it covers some drugs. If you are receiving a medication that has to be delivered by shot or intravenously at the doctor's office, then it's covered by Part B. It also covers about 27 different diagnostic tests. It also covers durable medical equipment, which is like walkers and wheelchairs and CPAPs, any equipment that you need for your medical care is medical equipment. Covers prosthetic devices, ambulance services only if it's an emergency. Your health is at risk. Medicare does not cover routine dental care, routine vision, routine hearing. Now, if you need surgery on any of those three, that's a different category. Part B will most likely cover that. Medicare does not cover long-term care or cosmetic surgery. Costs associated with Part B. This year's premium is $164.90, going up next year to $174.70. The annual deductible, $226, going up to $240 next year. So your annual deductible is the one deductible that is not picked up by your supplement. The law changed in 2020 so that you have to pay that now by yourself. Next. Automatic enrollment comes if you're on some type of Social Security benefit. They will automatically enroll you and send you your card 3 months ahead of your birthday month. Next. When to enroll? Those who are not collecting Social Security must enroll in Medicare Parts A and B. That is up to you. Nobody else can do that for you. You can go online at ssa.gov or make an appointment with your local Social Security office or just plain call Social Security. You need to ask yourself and find out, do I actually need to enroll in Medicare If you're covered under an employer group health plan, then you have credible insurance coverage and do not need to start any part of Medicare. Some people will go ahead and start Part A at this point. If you have a health savings account, you either need to quit putting money into that or just wait to start Part A. So those that have an employer with less than 20 employees must go ahead and start Medicare. But as long as you or your spouse are working and have a group health plan, you do not need to start Medicare. If you do not have that, penalties can arise. So your initial enrollment period, IEP, starts with the month you turn 65, the 3 months prior, and the 3 months after that. So most people will go ahead and get enrolled prior to that because their Part A and B will usually start the first day of their birthday month. Next. If you wait because you have other coverage, when you are going to retire from your work, it creates a special enrollment period. And there are a lot of those special enrollment periods. So note that when you get Part B going, then you have 63 days to get coverage for Part C or D. You have up to 8 months to get a Medigap supplement. Next. So to enroll in Part B, when you already have Part A, again, you can go back to Social Security website. There is an online application there. If you scroll all the way to the bottom of that ssa.gov website, you'll find a button that says Forms. The fourth and fifth ones down are that CMS L564, which is a request for employment verification. If you've gone past age 65, then the government needs to know that you've had credible insurance coverage. So this is a form that you give to your HR people to fill out. The other one is your application for enrollment in Part B. And then you submit both of those forms. Next. Now, if you have retiree health benefits from your work, then you should ask them if you should start a Medigap plan, Part D plan, or an Advantage plan, because they may stop your coverage from your retirement benefit. So anytime we start something new that can possibly replace the old, then it most likely will replace the old and you'll lose that benefit. So, okay, going back to original Medicare, when you have Part A and B, we need a supplement plan to pick up the 20% Medicare does not cover. So the Medigap picks up that 20% coinsurance and the copays and all the deductibles except Part B. Now, one thing I want you to know is that there are, in the state of South Dakota, 55 different Medigap plans that you could buy. All of these plans do the same thing. They are standardized. So a Plan G is a Plan G is a Plan G, regardless of the company. And the one thing you have to remember is that all of these plans are going to continue to go up as you age. So the key thing is to start with the cheapest plan you can find. At the bottom, we're talking about guaranteed issue right that lasts for 6 months. When you begin, you have guaranteed issue, which means that they cannot ask any health questions. So it doesn't matter if you have a clean bill of health or if you are on your deathbed, they cannot ask you any health questions and charge you more for the plan. Next. The other plan that you need to start is the Part D drug coverage. And that happens whether or not you are actually taking any medication or not. Because if we don't start the Part D within 63 days of Part B going active, then you can start being penalized. And those late enrollment penalties last the rest of your life. So next, we'll get into the cost with Part D. The monthly premiums, the lowest priced one in 2023 is $4.60. Next year, the cheapest plan will be 50 cents a month. Annual deductible for this year is $505. Next year, it's going up to $545. So if you have no medications, then you still need to get the cheapest plan that you can get as a placeholder. Annual deductibles do not engage on the generic drugs. So they go by tiers. Tier 1 and 2 are generic. You don't have to worry about the deductible until you get to tier 3 on up. So at the bottom, it talks about going to Medicare.gov and utilizing the plan finder. We'll talk about that later. Next. So basic enrollment periods. Again, special enrollment period, you cannot go 63 days without credible drug coverage. And every year on the annual election period or open enrollment, October 15th through December 7th, you need to go ahead and take a look at your drug plan for next year and see if it is still the cheapest plan for you to have. Otherwise, it's easy for you to either come in to us and we'll help you with that, or you can actually do that all on the plan finder on Medicare.gov. Next. Go down one. Yeah. Okay. Oh, let me go back up one. There we go. Medicare Advantage plans. So this is the other option for your Medicare benefits. It is a separate insurance policy that actually covers all of your Medicare benefits. Those plans must include everything original Medicare covers, but it does have the option to add additional benefits. The original was vision, dental, and hearing, but there are so many more different things that they provide and keep providing each year. So it depends on one plan to the next. And most of those plans offer drug coverage for Part D. When I started 3 years ago, their drug plans were not as good as the individual Part D, but now they're actually much cheaper than the Part D. You must continue to pay Part B premium. Some plans are required to pay an additional premium to the plan you selected. And most people nowadays can get an Advantage plan with a zero premium for both health and drug coverage. I would personally look at all the other ones available. I would rather pay more premium to make sure I have the best coverage. You need to understand the rules and the regulations of the plan that you are on regarding deductibles, co-payments, prior authorization, and what they're going to cover. Because in the long run, that is what they will go by. All right, Medicare Advantage enrollment period, all the same as the others, but there is a separate Medicare Advantage open enrollment. That comes from January 1st to March 31st. If you already have an Advantage plan, you can make one change per year to a different Advantage plan. You can also go back to original Medicare. Next. Now, 3 things you need to remember about Advantage plans. All of them have networks. So your providers, your doctors, clinics, hospitals, all need to be in their network, or you have to change and use one that is in their networks. All of those networks exist within a service area, a geographical area where inside that area you are in the network, outside this area you're considered out of network and could have to pay a greater share of the price, if not the whole price. And to cover all of that is out-of-pocket limits. So every plan in bold print has how much you might have to pay in that year before the plan kicks in and pays for everything. And those are usually divided between in-network cost and out-of-network. For example, some of the best $0 plans have an in-network cost of $3,900 or $4,000 if you're in network. If you're out of network, it's $8,600. So, and I tell people that Medicare covers preventive care very well, and you pay zero on either plan. But once we start seeing specialists and getting into their care, usually we're in their care from then on. And that is where we, on an Advantage plan, you'll begin to pay co-pays, deductibles, and co-insurance. So that's where you will hit that maximum out-of-pocket cost every year. So when I look at it, 2 questions I ask people to determine whether you want to go with original or Advantage. The first question is, are you going to travel? And I don't mean just a Sunday visit to see grandma. I mean, if you're going to go down south for 3 to 6 months, that's the kind of travel I talk about. If I'm going to do that, then I want to stay with original. Second question is, how much doctoring are you currently doing? If you're already seeing specialists, if you've already had a bypass, different things like that, if you're treating cancer, you're seeing a lot of doctors and you're doing a lot of treatment, then I would stay with original. Otherwise, the Advantage plans can work well for you as well. Now, this last slide is making Medicare affordable. And unfortunately, I run across a number of people who have not known this, and they have not started Part B because they couldn't afford it. And so we have two different programs. The Medicare Savings Program was set up to actually pay for that Medicare Part B premium. And the second one, the Low Income Subsidy Program, often called Extra Help, actually covers the drug plan. So your drug plan is zero premium, zero deductible, and this year your more expensive drugs are $4.15 or $10.35 for the most expensive kinds. But most all of your meds are going to be free. So please look at those two plans to see if they can help you. The resources. Every year, once you're on Medicare, they're going to send you the Medicare and You book. I call it the Medicare Bible. And unfortunately, most people read it as about as much as they do the other Bible. But that will give you a great overview on all of the parts of Medicare. For more information, going to the Medicare.gov website, go back up, please. You'll see on the website, below that lady's arms, there are 4 buttons there, and that second one says Find Health and Drug Plans. That is the plan finder that we use during open enrollment to compare people's drug plans. On that plan, once you push the button, the next page asks for your zip code, and then you get to choose, do I want to look at Advantage plans, drug plans, or the Medigap plans? And you can compare pricing on all of those. So, and that one is free to use, and you can play with that and find out what it's going to cost you. So there are actually a lot of resources for Medicare, and you can find them anywhere that you go in print. I tell people anymore, I use Google and just type in a question and it'll give me the answers. Medicare.gov has a search function. You can ask any question you want. There's a lot of information there. If you're more visual in nature, YouTube has hundreds and hundreds of videos on about every aspect of Medicare. So, and above and beyond all of that, you can call SHIINE. Okay, any questions?
I appreciate it, Tara. I'm going to take over and talk about SHIINE, but before I do, I know there's got to be questions. We got a couple remote groups that may not be able to talk in Zoom. Feel free to use the chat function as well and type it in there, and I'll keep an eye on that. But if there's any questions for Terry, and I see that we got another one of our Medicare professionals that logged in as well. So this is a great time to ask any questions you do have about Medicare. So if there are any questions, you can type them in, raise your hand, or just go ahead and unmute yourself and talk. Yeah, I'm hearing none and I'm seeing none. If there's any questions later on, type them in. And I know Terry's going to hang on here for the rest of the presentation too. So if there's any questions, type them in or raise your hand and we'll definitely get to them. So as you can tell, listening to Terry's presentation, your assumption that Medicare is confusing was just confirmed, which is kind of where the program SHIINE came in. SHIINE is a development by the Department of Human Services to administer several federal grant programs. Go ahead and go to the next slide, please. So SHIINE, like I said, it's completely federally funded. Essentially what happened is when Medicare first came out years and years ago, it caused a lot of confusion and there was no necessarily support for it. and it left our Medicare population and beneficiaries on their own to kind of figure it out. That caused a lot of contention through Congress and everybody else, and eventually they came out with programs to assist these beneficiaries and to stop Medicare fraud or help prevent Medicare fraud. And that's where these programs came in. So I know Terry talked a little bit about the SHIP program, or the State Health Insurance Program. That is one of the federal grants that is administered by SHIINE. And then we got the Senior Medicare Patrol, or SMP. That is a program that's specifically designed to help prevent, detect, and more importantly, report and convict fraud, specific fraud, Medicare fraud. And then we have the Medicare Improvement for Patients and Providers Act, or MIPA. And there's actually 3 grants that encompass MIPA, and those are basically supplement grants to help us reach our more rural population or low-income populations within South Dakota. All of these grant programs are administered by DHS, and I am the director of that program. And Terry, again, like I mentioned earlier, he's one of the top educators out in Sioux Falls, and I believe his supervisor is here as well. So if you had any questions specifically for the Sioux Falls area, both of those would be definitely good to answer. Next slide. I'm not going to read this all off to you. SHIINE has a large mission statement. I'm trying to adjust this mission statement to maybe 1 or 2 sentences. But I'll give you a second to read through it. But the things that I look at for SHIINE, I kind of split our mission into 2 generic statements, or 2 generic words. Next slide, please. So if you think about SHIINE, or you talk to someone about SHIINE, or you get a question, the 2 things that I want everybody to kind of walk away with when they're talking about the Senior Health Information Insurance Education Program is our main job for the staff and the volunteers is to provide information on anything and everything Medicare. That could include your plan itself. It could include enrollment problems. It could include how to use Medicare. I mean, there's a laundry list of information in hours and hours and hours of presentation or one-on-one counseling that can be provided in the world of Medicare. We help provide that information, and we also educate people not only on Medicare, but we educate through one-on-one counseling and group outreach, much like this, on how to detect Medicare fraud, prevent Medicare fraud, and then more importantly, the correct channels to report it and what information needs to be reported if we intend to pursue legal actions and convict the fraudster if able. Next slide. So I know this is hard to see on the slide itself. This is just a general overview of how SHIINE is broke up in the state. It's all the federal grants are administered by ACL, or the Administration of Community Living. And then we take all 6 of these grants, we administer them at DHS. I am the only state representative, or the only state employee for SHIINE. And then we break it down into 3 regions. So all of our eastern counties have a main office out of Sioux Falls, and I have a coordinator and several staff down there that operate as counselors and educators and supervisors for our volunteers. And then we have a central office in Pierre, located maybe a mile away from my office. And then we have an office with our coordinator for all the western counties, which is located in Rapid City. So western covers 16 counties. The central region is covering the 27 probably most rural counties in the state. And then the eastern region is covering the 23 easternmost counties. And then within those regions, the program is made up wholly of volunteers and partners. Without the volunteers and partners, it would be very, very difficult to get the information and education out. Next slide, please. So we do have staff and trained volunteers statewide. This is just a regional map, so you can kind of see what counties are covered by what representative, because at the end of this presentation, or actually I even think on the next slide, you can see the contact information for each region. So this will give you an idea if what county you're in, which contact number you should reach. But we all work together, collaborate together to cover the entire state. So if you contact any of the SHIINE representatives, we'd be able to get you in contact either with an educator or with a counselor. So these are the regional offices. I believe this PowerPoint will be made available in recording, or you can contact myself or Terry at any point as well, and we can get you in contact with whoever you're trying to look at. Okay, next slide, please. So SHIINE does a lot. The positive thing about SHIINE is you'll see a lot of marketing, a lot of advertising, especially during open enrollment period and things like that, to help people enroll in Medicare. The majority of the advertising and marketing you're going to see out there are insurance companies, insurance brokers that are selling their insurance program or selling their plan. SHIINE is not affiliated with any of them. We cannot be affiliated with any of them. We are 100% unbiased. And actually our volunteers, our partners, and the vast majority of our staff are Medicare beneficiaries themselves that went through the confusion and the problems or were a victim of fraud and then got involved in our program to ensure that the other people in their family and community have assistance that either they were provided at that point or that they didn't have provided, which caused them some problems. We provide it 100% free. Everything is confidential. Our volunteers and staff go through background checks, application and interview process, and they're trained on multiple facets of Medicare depending on what position they're volunteering for. Next slide, please. The importance of these volunteers is SHIINE 100% relies on volunteers. We're looking for volunteers across the state. Right now we have volunteers in about 1/3 of the state. We actually have a volunteer in that county covering an entire county. So for example, up in Brown County, I think we got 2 volunteers up there right now that are covering all of Brown County. There's a large Medicare beneficiary population up there that is covered by just those two individuals. And then we got the other 2/3 of the state where we don't necessarily have a counselor in that county. So we got counselors or staff from a different county covering it either virtually or traveling to the beneficiaries there. So the more word of mouth we can get out there to get volunteers and the more people we can get involved in the program, the more people are going to become aware of the services that we have and the services that we can provide. There's several, you go back up one slide, sorry. There's several things you can volunteer for. Most people think when they're thinking volunteers for SHIINE, they're thinking counselors. We do have counselors. The vast majority of our volunteers are trained as counselors, but we're also looking for people to help recruit or advertise. Educators like Terry that, every opportunity he gets will get in front of an audience and just talk about Medicare, train on Medicare, answer questions specific about Medicare. We're looking for any administrative help or any marketing help. Okay, next slide, please. Okay, we do several things for the beneficiaries. The big thing is, as I know you're all fully aware of, it's a very, very confusing topic. It's difficult to understand the enrollment process or to get enrolled in a plan that best suits your needs or to use Medicare. So through the assistance that we provide, we give them a better understanding of their position, a better understanding of what plan fits them and how to use the plan. We go through and make sure they understand all their options. But the big thing is we take a lot of that stress out of the beneficiary's hands and we partner with them. We go along that journey with them, as an unbiased and confidential resource for them. We do save money especially during open enrollment period when we're looking at Part D plans. There really is no difference from the Part D plans. They're all managed by the federal government. So what medications are covered or aren't covered are the same across the board and dictated by the feds. The only difference between them is the costs. So it's highly encouraged that every beneficiary will look at their plan on an annual basis because costs change constantly. So we do save beneficiaries money every year. Just last year, we saved one beneficiary 5 figures. I think it was like $36,000 that year that we saved him in Part D costs. And we save them a lot of time and going out there and doing the research and contacting Medicare or going through the struggles themselves. And then we help the families a lot. There's a lot of guilt associated, for example, with Medicare fraud. Victims of Medicare fraud often feel like it was their fault. They could have lost their life savings, which obviously affects everybody else. We will save the money or save the family money if it's available, and we help them comprehend their position and their plans. Next slide, please. So there's several contact numbers for SHIINE. If you look at that previous map that I showed you, got Eastern, Central, and Western. These are the basic toll-free numbers that you can contact. But if you email me or you go to the dhs.sd.gov, which is that link you see right there, that takes you directly to DHS, and then there is a link to get to me. But if you, like Terry said, if you Google SHIINE, if you Google SHIP, which is the State Health Insurance Program, all of those websites and federal programs are going to direct you back to your state representative either way. I want to talk a little bit before we go. I think we still got a little bit of time. So I want to talk a little bit about some of the frauds that we're seeing. If you go to the OIG website or you go to the website for the Senior Medicare Patrol, there is a link at the top of both of those sites where you can go to fraud. And these are current or developing consumer fraud alerts specific to Medicare. There's dozens that are currently happening within our state that our program's aware of. But unfortunately, Medicare fraud as a whole tends to go unreported. So the more information and education and training we get out there, the better. Some examples that's been very prevalent over the past several years is genetic testing fraud. And this has changed a little bit because of the development of artificial intelligence or AI. But essentially with genetic testing fraud, it occurs when Medicare is billed for a test or screening that's not necessary or wasn't ordered by the beneficiary themselves. It's advertised through free cancer screening tests, hereditary cancer screenings, DNA screening test, dementia screening, and Parkinson's screening. When they're offering these for free, and in order to receive these screening or these tests, all you have to do is provide your Medicare number. Well, they'll take that Medicare number and then they're ordering all this stuff on your behalf and billing Medicare for it. This is happening quite often. And now, kind of in addition to that, with artificial intelligence, AI now has the ability to contact a beneficiary, and you'll get on the phone and you'll be 100%, you'll be talking to your grandson. It's your grandson's voice, the same mannerisms, same everything. It's your grandson asking for money for this, asking for assistance for this, and it's a computer program that you're talking to. So the amount of people that they can fraud skyrocketed by about 3,000%. So instead of having a telemarketer sitting there making these calls, now they just have a computer going through a Rolodex of phone numbers or contact information. So it's encouraged, even if you're asked questions by someone you do not know, don't even answer the yes or no questions, because that simple yes question will get you as a main contact for potential fraud. Another one, probably the most unreported one, unfortunately, is hospice care. Hospice care fraud is essentially the fraudsters are targeting beneficiaries at senior centers or nursing homes or long care facilities that have an expectancy to live 6 months plus. And what they're doing is they're taking very aggressive tactics, and they're convincing these beneficiaries to accept hospice care. The problem with that, it doesn't necessarily, it's an impact financially to Medicare. Medicare right now is being frauded about a little over $60 billion a year of Medicare fraud. And it's one of the programs of the federal government that's always in question of having money pulled from it when they're doing their budget talks. But when it comes to hospice care, if that beneficiary accepts the hospice care because of this fraudster convincing them to, or almost bullying them into, what happens is Medicare may be covering this beneficiary for preventative medicine or preventative care. For example, if you have cancer, they may be covering you currently for chemotherapy. If you accept hospice care, Medicare will no longer cover chemotherapy because that's preventative care. In hospice, once you go into hospice, you're only covered for comfort care. Preventive care is no longer covered by Medicare. So significant dangerous results to beneficiaries, and this is happening in our state currently. I know of 4 that we are helping gather information and report to the OIG, or the Office of the Inspector General, currently, and they're in almost every county of the state is seeing a form of fraud, because there's dozens of them out there. And the last one that I kind of want to mention is just Medicare fraud itself, or Medicare card fraud itself. It happened last year. There were quite a few in our state, but it happened nationally to the point that it was actually addressed by CMS and briefed to Congress. But there were scammers out there that were contacting Medicare beneficiaries and essentially telling them that Medicare.gov, or Medicare themselves, is issuing everybody a nice laminated Medicare card. Because if you have a Medicare card, it's kind of a flimsy card that's very, very hard to keep care of. Put it in the laundry and it's pretty much done for. So people were contacting and saying, we're going to provide you this laminated Medicare card. All you have to do is provide us your Medicare number and you'll receive it in the mail. Unfortunately, thousands and thousands of Medicare numbers were given due to this fraud. It's easy to get another Medicare card. If you contact SHIINE, we'll definitely help you with it. But the big takeaway from that is Medicare is never going to contact you and request your Medicare number. They're never going to contact you and talk about your plan or your health unless you initiate that call because you're requesting service from Medicare. And if anybody contacts you and it's not your doctor or someone you are currently receiving care from, and they're asking questions about your health or trying to provide you back braces or knee braces or anything along those lines, but they are not your doctor, it's encouraged to not even talk to them. Talk to your doctor to see if you even need that care, to make sure that this is not a fraudster trying to bill Medicare with your number. So there's quite a bit of stuff that SHIINE does. We are very, very easy to get a hold of. We are trying to expand and grow ever since we kind of came on the back end of COVID. The one-on-one counselings during COVID really hit the program hard, and we're kind of in an uphill swing right now post-COVID, getting volunteers involved back into the program. And we'll encourage anybody to get the word out there about the program. So if anybody runs into problems, they know who to contact and they know what services we can provide. So with that, I know we're still a little early. It's 12:20, but we'll definitely leave some time for questions for Terry. We got Karen Healy in here, who's the supervisor down in Sioux Falls, and myself about any of these federal programs.
I'll start it off here. I've got a couple, we get some questions sometimes here at Prairie Doc. We know that there's been some recent changes with health administrations, whether it's a hospital or a clinic, that are no longer going to be doing Medicare Advantage plans. What's the best step for individuals? Should they call their local clinic? Should they call their local hospital and double check before they sign up, just to make sure, like you talked about, that they're getting the best healthcare plan for them? Like, what's the best way to go about that?
We're not hearing you, Terry. I see you're trying to talk. I think your phone's muted still.
Okay, that's better. In that area, your agent that you're talking to should be telling you the truth, but you can always call the hospital and find out from them as well if they're in your plan. The key thing is that in this area, even though you're out of network with that hospital, you're still covered for anything in the hospital. And most of the insurance plans or the Advantage plans, the out-of-pocket cost for the hospital was the same as the in-network cost. So it's not really costing you anything more.
To kind of piggyback off of that, it kind of goes into some of our marketing fraud as well. Like Terry said, the insurance plans and the Medicare Advantage plans are required by law now to inform you what is and is not what is and is not within your network. So if they're providing you something on their plan, they have to let you know that it's in your network, and they're not allowed to sell you something that is out of the network. That just happened this year with the marketing rules that came down from CMS. I'm sure the past several years, we have all seen Joe Namath get on TV and sell these outstanding Medicare Advantage plans. A lot of people enrolled in them because they're very, very cost effective and they're good plans. And you don't necessarily know you were taken advantage of until you try to go use that plan and you find out that you're out of network, or the services that you're paying for are just not available in your area, especially in the rural areas that we have within South Dakota. You may definitely run into that plan. So it's important to check and double check all that as you're enrolling and annually. But again, that's one of the things our counselors will look at on your behalf too, to make sure that you're with a pharmacy within your network. If you're not able to travel, we'll try our best to get you a pharmacy closer to you. I mean, there's a lot that goes into it, but that is one of the concerns that we see.
Can individuals, I mean, as a state, we're a pretty rural state. Can individuals that are not close to a representative give you guys a call and do either a Zoom or a telephone call if they do have questions about what programs to sign up for?
Absolutely. We have contacts and emails in every region. We do cover every single county. If you can't get a hold of your region rep, you can absolutely contact me. We do cover every county. If it's a rural county, our volunteers and our counselors and our staff, most times we'll try to arrange that one-on-one meeting and actually travel to the beneficiary. That is all covered with the federal grant dollars that we have. If that is unavailable or the beneficiary is unavailable to meet one-on-one, we do virtual counselings over Zoom. There's multiple ways that we can make it happen to make sure that we're answering the questions. We'll even answer basic questions over email, as long as no private medical information or private information of the beneficiary is shared unencrypted. So we try to do everything in person, but yes, virtual is absolutely an option for our rural beneficiaries.
Hey, Ashley, this is Tad. Can you hear me?
Yeah.
Great. Hey, I just want to thank you all for doing this. I'm a retired physician. I've been on Medicare for 4 years, and it still confuses me. But this presentation program is very, very helpful, and I know it's being recorded. Ashley, hopefully we can make this available through Prairie Doc here down the line. So, but thank you all for taking the time. It was very informative. I wasn't even aware of SHIINE, so thanks.
And we're going to throw this up on our social media page and our YouTube page, and then put all of SHIINE's information up there as well. So that way, when people do have questions, they'll know where to call. This question is kind of for Terry. Are there some pretty common questions that you're seeing this year through that you get kind of from a lot of people in regards to their programs this year? And Terry, you'll probably have to unmute yourself again.
Well, basically, there's just a lot of people with Advantage plans that are asking the questions about if that's the best plan for them. And so we go through all of this information with them, and then they have to kind of make the choice. One of the problems with an Advantage plan, you have 12 months when you first go on it as a trial period. And if you want to make a change back to original Medicare at that point, you can do that without incurring medical questions and things like that. But most people are beyond that point, and to find a supplement without getting rated up for their medical issues is a lot more difficult.
I will say that I have recently helped my dad with his Medicare plan here, and it is still just as confusing after even reading all this, right? Like, I feel like it's a lot of information on trying to figure out what's best. So thanks to you guys for navigating what is healthcare in general. Every season of life that you have to deal with healthcare is confusing. So this one just seems especially. But are there any other questions out there? And please feel free to, if you have some questions, you can email us at Prairie Doc, and we'll happily get you connected with those at SHIINE that can help answer your questions. That way you make that initial connection there, and send it that way, or you can type it in the chat or just email us. We're happy to do those kind of things as well.
I will just add one thing, and Tad, I appreciate your remarks. But the one thing that you said there towards the end is absolutely what I would like to address as a director is that you're not alone as far as people not knowing about SHIINE, because there's a lot of counties that are really, really hard to reach with the small amount of volunteers and staff that we have. So I did put the SHIINE Facebook page as a link there. I encourage you all to follow that page. all these scam alerts or enrollment periods or contact information or volunteer opportunities. I share these all on that Facebook page, and I would ask and encourage you all to share that page as well, because if you are a Medicare beneficiary, I would make an educated guess that you have a significant friends list on your Facebook of the same age group and the same beneficiaries that may not know about SHIINE as well. So I appreciate the word of mouth advertising as much as we can. It is a very valuable service, a very unbiased service, and it's free of charge for anything and everything.
Are there any final questions for today? I will say with that, oh yeah, do we have a question?
Can you hear me?
Yes.
Okay, so my question, I have several questions. Like this 2024 guide, does that come automatically in the mail, or is that something you have to request? I'm not hearing you.
Once you're on Medicare, that is sent automatically to you every fall. But if you don't have one, you can always call SHIINE. Stop by the office. We have publications on about every aspect of Medicare.
Okay, and where is the office in Sioux Falls?
2500 West 46th Street.
Okay, is that in the Active Generations building?
No, we're 2 doors to the west.
2 doors west. Okay, and there was something about like right now is the open enrollment, but then there was something about Advantage Plan open enrollment is January, February, March. So if I'm right now enrolled in the original plan, but I want to look at the other, do I make the change now or in January to March?
You can change now. And if you're computer savvy, I would go on Medicare.gov and use the plan finder to be able to compare 3 plans side by side.
Okay, so I'm on something now, and I'm just wondering about brokers, how you choose the best brokers. So like I'm got a, the Part D and then the A and B, and they are sending information, but my broker hasn't sent me anything. I'm hearing nothing. Is that the normal?
So you have a Medigap supplement?
Right now I do. And I'm just, in the past, I really needed it because I was going to the hospital for various things, but my health is somewhat better. And I'm wondering how smart it is to be moving over to Advantage, or, because I'm getting older, it seems like I would want to go. I don't know. Does that make sense?
Yes, it does. The one advantage for the original is that your Medigap supplement picks everything up and it kind of runs in the background, and you never really hear anything from them, except annually that you might have to pay more premium for the next year.
Okay.
But you can come and see us, and we can help you take a look at the different Advantage plans that are available. And each one of those comes with a phone number to call and a website to follow up on.
Okay. Okay, and the open enrollment ends, let's see, December 7th. So that's about a week and a day. Are you pretty booked up with this being the last week, or is there still time to do something?
Actually, we have a lot of appointments that are still available.
Okay. Okay. Good food for thought. Really excellent job today. I mean, I enrolled in this or got the information during COVID, and it was so hard to not do this in person. And I'm savvy now with Zoom, but back then I wasn't. So thank you again for doing this.
Well, thank you.
Are there any more questions?
And again, I know we got a couple of remote groups as well. So if you want to type any into chat, I'm watching that as well.
Don't be shy. I couldn't figure out how to do it, and I had to just keep pressing buttons until I figured it out. Otherwise, I would have asked my questions sooner. No, I am not computer savvy. I just don't give up.
Well, we will try to get this up today. Like that's where I'm hoping that we get it up on the internet. We know that we're on a time crunch here with December 7th quickly approaching. And so we hope that if you have any other questions, we will make sure that in our social media posts that we put out that you have contact information for SHIINE and put some address and phone numbers up there too. So good luck to everybody trying to navigate healthcare here this next week or in general. And thanks to our friends over at SHIINE for doing an amazing presentation and helping those navigate Medicare. Thank you, guys.
Thank you very much.
Thanks, everyone, and have a happy holiday as well.
You too.